Many years ago, I spent over 450 days as a patient, so I kind of learned firsthand the things that make a difference, and many times it's the small stuff that actually makes the biggest impact. So I kind of feel like it was my God-given mission to stay focused on the quality aspect and especially that patient experience.
Hello, may I come in? How are you? Long time no see.
Good afternoon, sir.
Good to see you.
We have a quote: if you are not taking care of the patient yourself, then anyone else that's part of our team's job is to support those that do. And so as administrative staff, we kind of stay focused on that. We try our hardest with the administrative process to make sure there's continuity for the patient. So when we're making assignments, it's very, very important to us that they have a physician that they can become more familiar with over a few span of days. We use volunteers to follow up with every new patient. And those volunteers walk in the room, they greet that patient, they ask if they've met their physician yet. Then if they pick up on any clue that that patient has a concern or maybe is not having the best experience, we have a nurse in our office that they would speak to about that. And then that nurse comes back to me and says, wow, doesn't seem to be a good fit between that physician and that patient. Those are the kinds of things that I would immediately follow up on. And so frequently it's just a matter of understanding what might not have been well aligned, and then what can we do to make that work out better. The single most important thing that we've done is so simple, and that is we put in a line. It's called a communication line. And if a physician has a concern, they can leave that on the line, and I'm monitoring the line all the time. It's not a live line, but I'd rather answer it almost 24 hours a day. So we take those concerns and we immediately get a hold of the right parties. That absolutely has been a transforming vehicle. It allows patients and families to leave concerns. It allows nurses to leave concerns. And another real important initiative is a program called Evidence-Based Co-Design. We refer to it as EBCD. We brought in outside people and asked them to shadow a set number of our doctors as they conducted their visits. Those same people would return later to interview the patient. And they would mention then, I watched this interaction, so tell me parts of that you liked. And then they would also hit, what do you wish they would have done differently than what they did?
There was a group of patients, about 30 of us, who met, and it became a very productive session because everybody brought different experiences about what could be done to improve. And then the doctors and the nurses met in a separate group, and then the groups got together, and out of that came a plan for both short-term and long-term initiatives that could help improve everything in the hospital.
I think the important thing that I identify are some of the real basics. Did the individual coming into the room take time to say their name clearly, to find out if they were in the right room? And the way they address those kind of things is really important. If they're looking at a chart and rattling off statistics, it's not such a warm and friendly start. But if they can look the person in the eye and say, am I speaking to, and fill in the name. And would you mind repeating your birthday just one more time so I can be sure it's you? Those kind of little gestures make it humane. And it kind of alleviates some of the vulnerability the person laying in the bed might be experiencing.
Caring for patients, to me, really is all about making patients feel like they're part of the family. And a lot of it is making sure the patient knows that you've got the time, making sure the patient knows that you care, and making sure the patient knows what you know. And that's like one thing I like to say to my patients is, my job is for you to know what I know.
Everyone, I think, is pretty well aware of the fact that doctors can't predict when they're going to visit the patient. but it would certainly help if some things are passed on, such as there's a 9:30 huddle every day, and maybe from 9:30 to 10:30, the patient or the caregiver can change clothes, maybe get something to eat, bathe, whatever. And that kind of information, if passed on to the family, would make a big difference. Next, as part of what makes a good hospital experience to me, is a very caring culture. When you're in the hospital, you have trust in the doctors, and the doctors are well qualified. We're very blessed here at First Health, but if the caring doesn't come through and the communication doesn't happen, the professional skills can be overridden. So it's extremely important that that caring culture and the communication be inculcated in everybody.
I want to make sure the patient knows that when I enter that room, they are my focus. I'm going to shut the door so that they know that we have privacy. I'm going to sit down so they know I'm going to be there a while. I'm going to mute the TV so that they know that I'm listening to them. I'm going to give them my card so that they know that they can reach out to me anytime they need anything, and they remember me, and they can ask for me by name, first name even. All of these things kind of culminate in just that one fact that they're the center of attention, they're the priority, they're not some prisoner and the term of their prison sentence is unknown. They are in command of their care, and we're just the liaison.
Perhaps at the very top of the list from the experience-based co-design thing was the patient needs to know what's happening throughout the day.
Every single patient asked that every physician would inform them of next steps. And they wanted to know more about the doc. They wanted to know something personal about that doc. So we redesigned the business cards. And I mention that because then on the back of the card, if a physician's willing to share, then they also have information about special hobbies, where they went to school. And sometimes it's that tiny piece that connects you back, and it just forms a fast connection. The other thing we found from the physician's interview, so more from a wellness perspective, what would they need more of to feel happier with their job? They wanted more clinical focus. So we actually have one of our physicians that leads our clinical development. They have once a month a clinical topic. It is standing room only. It is quite exciting to be a part of those. One, that stimulates camaraderie. Two, we are increasing every day the clinical competence of our docs. But more importantly, it kind of reminds us all of why we chose medicine or we chose healthcare to be a part of.
We've all spent a lot of time training and basically having this ingrained idea that we're, have of the stature, but that needs to go out the window. And so my biggest piece of advice for providers would be take that little perception that you've developed over the years, that you're at the top of the heap, throw that out the window. The patient's at the top of the heap. Once you have learned that very important and salient fact, all of these smaller items of ensuring the patient and family members know that they're the center of the experience come easy.
I don't think we ever lose our focus on our number one mission, and that is to care for the patient, and to do that with empathy, and to do that in a way that best fits that patient. And it's not a one-size-fits-all. I've worked in so many health systems, and I think everybody says they are all about the quality, but I have to say First Health practices what they preach. They really do, in so many ways.